Welcome, everyone. Consider this explainer your official boot camp orientation. Today, we're going to absolutely master the mechanics of emergency-ready primary care. You are stepping into the shoes of an aspiring community health worker, and your mission is to understand exactly how the Aniyom Foundation, or JAF, trains its frontline defenders. So grab your notebooks, because this intensive session is designed to transform you into an essential asset for global health security. Let's get into it. Okay, let's dive into this syllabus. We're going to cover 1. Frontline health emergencies. 2. The GAF training model. 3. Pillars 1 and 2. 4. Pillars 3 and 4. 5. Pillar 5. The workforce. And finally, 6. Your path to impact. So I want you to ask yourself right now, are you ready to defend the front lines? Because honestly, the stakes are incredibly high here. In hard-to-reach areas of Africa, from rural villages to crowded urban centers, communities face a silent, continuous threat. We're talking about sudden outbreaks of vaccine-preventable diseases like cholera, mpox, and yellow fever. When these fast-moving emergencies strike, fragile health systems can completely collapse without a trained, resilient workforce ready to step into the breach. Well, this is exactly where your expert mentor steps in. The Aniyom Foundation operates on this exact philosophy, a story of turning vulnerability into resilience through innovation, collaboration, and a relentless commitment to reaching the most marginalized populations. GAF is going to be your guide on this heroic journey, giving you the actual tools to fight health disasters effectively. Section 1. Frontline Health Emergencies. Section 2. The GAF Training Model. So how do we actually fight back against these emergencies? By building deep, localized capacity. GAF doesn't just drop in temporary aid. They reverse community vulnerability by transforming local youth into skilled frontline experts. And if you're wondering if this model really works, just look at this number, 20,000. That is the massive scale of health workers, immunization officers, surveillance teams, data analysts, already empowered by GAF across all 55 African member states. When you enter this training pipeline, you're joining an incredibly credible continent-wide network of professionals.
But you know, the structure of this workforce isn't just about raw numbers. It's about radical inclusion. GAF deliberately targets 51% women and specifically mandates 4% representation for persons with disabilities alongside 45% other youth. This rigorous model empowers underrepresented voices, making absolutely sure the frontline reflects the very communities it protects.
So, what is the exact blueprint of your journey? Well, it begins with targeted mobilization and screening to match you at the right path. Step 2 is a 3 to 4 month blended skilling period, combining in-person workshops with digital modules. Step 3 takes you right into a hands-on, paid, 6-month internship with public health institutions or pharma companies. And finally, you get end-to-end post-placement mentorship to ensure you transition seamlessly into permanent employment. Section 3. Pillars 1 and 2. Now we're getting to the real core of your academic and practical training, the emergency-ready primary health care curriculum. Pillar 1 is Connect. This revolves entirely around risk communication and community engagement, or RCCE. So the crucial point is that a health system is only as strong as the community's trust in it. You're going to learn to establish digital systems and feedback loops that connect communities directly to accurate, life-saving information, bypassing all those deadly rumors and misinformation. As a recruit, your actionable duties here are super specific. You aren't just talking to people, you are literally the vital link building interoperable digital platforms. You'll facilitate community feedback mechanisms, actually listening to what the community is telling you, and enable rapid information sharing so that when an outbreak starts, the community knows exactly how to respond safely. Which brings us to Pillar 2, Detect. Think of this as your early warning radar. Detection is the absolutely critical ability to spot an outbreak before it spreads out of control. It involves active, relentless surveillance, identifying early cases, and getting that data into the hands of regional decision-makers at lightning speed. On the ground, detect means active case detection and immediate notification. It means executing safe sample collection and navigating the logistics to transport those samples to labs. And crucially, it means mastering digital reporting. You will be trained on the exact platforms used by GAFIC and global health bodies like DHS2 and SORMOS to track epidemiological data in real time. Section 4. Pillars 3 and 4. Once you've connected with the community and detected a threat, you immediately transition to defense. Let's move to and see how this builds into Pillar 3, which is Protect. This means securing the environment and the population against diseases through proactive physical measures. It's basically the defensive shield you build around a vulnerable community, utilizing infection control, mass vaccination, and securing the fundamental building blocks of health: water, sanitation, and hygiene, often referred to as WASH.
Your responsibilities here? Enforcing strict infection prevention and control, or IPC. You'll help execute reactive mass vaccination campaigns, making sure cold chain equipment is functioning properly. And you will maintain climate-resilient WASH facilities. Just to ground this in reality, GOF recently utilized research to provide climate-resilient WASH facilities to 40 primary schools across Nigeria. That is the kind of tangible, on-the-ground protection you'll be deploying.
Pillar 4 is treat. When disease inevitably breaks through the defenses, you must be ready to manage cases across a variety of hazards. But importantly, treat also means ensuring the continuity of essential, everyday medical care even while a disaster is literally unfolding around you.
Your actionable duties for treatment are incredibly precise. You're establishing robust screening and triage isolation spaces at primary care centers. You're ensuring resilient patient referral pathways are maintained so critical patients get advanced care, and you are managing the complex supply chain of essential medicines and rapid diagnostic kits, making sure your facility doesn't run dry when resources are stretched to their absolute limit.
Section 5, Pillar 5, the workforce. Listen, you could know exactly how to administer a vaccine or track an illness, but without this final pillar, the entire mission fails. This is workforce and legal readiness. It's about ensuring that all community health operations are safe, compliant, and legally prepared. A worker who is legally protected, ethically grounded, and physically safe is the most effective worker. This pillar ensures you are ready to deploy without ever becoming a liability to yourself or the community.
In practice, this means you will uphold strict workplace standards. You're going to adhere to a zero-tolerance policy for protection from sexual exploitation and abuse, or PSEA. You'll ensure occupational health and safety standards, meaning the proper use of personal protective equipment, and finally, you will maintain strict regulatory compliance, adhering to national bodies like NAFDAC in Nigeria to guarantee that all medical interventions are entirely legal and safe.
Section 6, your path to impact. And this brilliantly illustrates the massive return on investment from mastering these 5 pillars for both you and your community. Think about the status quo: a vulnerable community plagued by silent threats, fragile systems, and a super high disease burden. But then, thanks to your deployment of the GOF model, you transform that into an emergency-ready community. We're talking early detection, a resilient, legally compliant workforce, and overall wellness. It's night and day.
So, recruit, we end your orientation with one final huge question. Will you answer the call to transform your community's vulnerability into total resilience? The front line is waiting. The training is rigorous, but man, the impact is profound. Review these pillars, understand your role, and take that step to join the frontline defense. Thank you so much for joining this explainer, and we will see you out in the field.